Hi, my name is Kristen Fitzwater. I'm a GOCAPS student and I go to the Health and Medicine strand. So I'm going to show you a couple pictures of our classroom. So this is how our classroom is set up. We are actually having a guest speaker right now. This is at the beginning of the year. We were going through orientation with Cox. So that's what our classroom looks like. This is a picture when we got to tour like all the hospitals. So this is touring Mercy. We're actually on the helipad right now. So that was super cool just to see like how it was made and like how the helicopters like lift off and how quick they get back. It was really cool to check out. This picture, recently in our job shadows, I think Jeff talked about how we have been job shadowing Tuesdays and Thursdays. A lot of us have been seeing surgery, so our teacher thought it'd be a good idea to set up kind of a simulation. So a lot of the surgeries nowadays are done arthroscopically through scopes. So like what happens in an actual operation room is the doctor or the surgeon is using scopes to go into the body and is looking at it on the screen. So the computer screen over here represents the camera, and then we had to set up like PVC pipes on top of each other with our scopes. So that was a cool simulation to do. Jeff and I this week are actually doing job shadowing in a lab, so like a phlebotomist lab. And this is one of our classmates. He's actually able to test blood in the lab, so that was something really cool that he got to do. Jeff and I spent a good time yesterday in their microbiology unit, checking out different types of bacteria and stuff, so that was really cool. We also have a lot of guest speakers. This is actually Dr. Mahaffey. He's the physician with the St. Louis Cardinals, so that was super cool to hear him speak. And like I said, a lot of the stuff we do is project-based learning, which I'm going to go more into the projects that we're actually doing right now. So this is one of our first projects that we did. We had to design our own emergency room. So we got to tour all the emergency rooms at Mercy and Cox. And then we had to design our own, like what's efficient and the like latest technology that we needed. So this is one of the first projects we did, and it's a lot of collaboration with students from other schools. So that was really cool too. So that's the end of the little pictures that I have. Okay, so next I'm going to talk about the projects. So we do projects with partners. So right now we started a project with the Greene County Health Department. This is the little paper that they gave us. It's about food safety for volunteers. So it's actually a concession stand project we're working on. Our objective is to develop a way to present information to volunteers so they know how important food safety is. Foodborne illness is a big thing right now, and a lot of it stems from the way that people prepare things. So we set up our meeting and we met with the our lady at the Greene County Health Department that set up this project. She gave us this packet of information. So right now they have this little booklet that's like super long and boring and no one wants to read it and stuff. So we are developing a way to present this information to volunteers so these things get taken care of. Because many times people don't think about washing their hands before they put their gloves on or things like that. So that's what they did. They gave us back information. They said, meet us back in 4 weeks and tell us what you got. So that's our project with the Greene County Health Department right now. We also do a lot of projects based in class because, like Jeff said, it's project-based learning, which is really cool. It's different from like a normal high school setting. So right now we are doing an epidemiology unit, so that's infectious diseases. So he gave us like a scenario, and the scenario talks about 5 patients came in over the span of 2 to 3 days, and they all are suffering from these certain issues or complications, and they're getting worse. So that's what he gave to start off with. So we're looking at their infectious disease stuff, and then he gives us their patient vital signs. So then we compare all of their vital signs and how they relate to each other to try to point out different patterns. Gives us the urine analysis. So then I've made notes here just about different patterns that I've seen. And he gives us their general lab tests, so like their white blood cell count, hemoglobin percentages, glucose level, protein level, all those different things. So it's really, I mean, you're constantly looking up things, learning as you go. And last but not least, MRI, brain scan images. So we're comparing all these things to try to narrow down what the cause of their illness is, and if it's infectious, if they got it from each other, or if it's from another source. So we're in the middle of that project right now, which is also super cool. I really enjoy this program because it's different than sitting in high school every day. You're getting hands-on experience. I know I want to go in the medical field, but it's really cool to see just all these different fields. Like, I never would have went into a lab because I never really wanted to do that, but it was super cool to see how they test blood types and how they figure out if you have strep or E. coli or just different things like that. So it's really opening my eyes to all the many different fields in the medical realm and how they work together to help each other, really. So sorry that I can't be here once again and talk about all this in person, but thank you for watching, and I hope that you feel better informed about the GOCAPS Medical and Health Program. Thank you.